Thomas Jefferson was the first president to talk about the importance of individual health. Franklin Roosevelt hoped that health security would be the other half of the Social Security system, but political realities forced President Roosevelt to discard that dream, and the result, as we know, has been ongoing insecurity for millions of hardworking Americans. When Harry Truman campaigned for a comprehensive health program in 1945, he told Congress, and I quote, "Millions of our citizens do not now have a full measure of opportunity to achieve and enjoy good health. Millions do not now have protection or security against the economic effects of sickness." But President Truman's pleas for health security fell victim to the politics of the day and scares about socialized medicine. Dwight Eisenhower came before the Congress in 1955 and said that health insurance could be improved by expanding the scope of the benefits provided. John F. Kennedy proposed expanding coverage to the elderly and the mentally ill. By the early 1960s, both Presidents Eisenhower and Kennedy could not say that their hopes of health security had gone forward, but instead they saw once again the familiar sight of a dream of health security being stalled by outside interest groups and partisan bickering in the Congress. Then came Presidents Lyndon Johnson, Richard Nixon, and Jimmy Carter. There was progress made on Medicare and Medicaid. President Nixon came forward with a comprehensive health care reform proposal that built on the employer-employee system. President Carter proposed a number of advances, and particularly Mrs. Carter championed the cause of mental health benefits. They, too, envisioned reforms that would give Americans more health security and our nation more economic security. But like their predecessors, their efforts and their hopes were not realized. So here we are in 1993, 50 years after the chairman's father introduced the first legislation. We are still wrestling with many of the same issues and the same problems that previous generations have worked on. The difference is that today our system has many problems that have gotten increasingly expensive, and the difficulties of delivering health care in a cost-effective way is making a challenge to the fiscal integrity of the federal and state governments, to businesses, to individuals across the country. Now is our chance to beat the historical odds.
Health emergencies can't wait for us to have some theoretical debate about some better idea that will never, ever come to pass.